Okay, we're recording, so let me, I'll now open the room in
Steve, do I have a minute to grab some water?
Good morning or afternoon, everyone that's just joining us. We'll be starting the webinar in just another minute, giving a chance for other attendees to log in. So we'll start this in a couple of minutes, in a minute or so. Thank you. All right, well, why don't we go ahead and get started. Good morning, everyone. My name is Steve Toller. I'm a partner with Management Partners, and we're happy to help the Local Government Hispanic Network and ICMA host this event today. Just a couple of quick housekeeping items before we get started. All of you are attendees. We're not able to see you, but we will have an opportunity to get interaction with you at toward the middle to end of the presentation. And just real briefly, just wanted to share with you that we're going to be using the electronic raise hand feature to do that. And so what you will do is in your application that you're seeing here right now, you'll go down to the bottom. There should be an icon there that says raise hand. You'll be able to click on that, and that will raise your hand electronically and let us know that you have a question or a comment that you'd like to make. And so that will be the way for us to be able to understand that you want to do that. What I'll do is I will then unmute your microphone so that you have an opportunity to ask the question, and then we'll have the panelists address that question. And if for some reason you decide, well, okay, I don't want to ask the question, you can lower your hand by clicking on the icon that you see down below, and that will turn it back off and allow you to raise your hand at a later time. So that's that. So with that, let me turn this over to Pat Martell, who is the ICMA West Coast Regional Manager, and I will turn it over to her. Pat.
Thank you very much, Steve. Good morning, everyone. It's a pleasure to be with you today on behalf of the Local Government Hispanic Network, and to be talking about something that is so important to all of us today, which is issues related to COVID-19's pandemic. So before we start, I'd like to introduce our panelists who will be responding to a number of questions today that hopefully will be of benefit to you. So I will introduce them and then we will start the session. First, we have Carlos Bahia, who is the Deputy City Manager of Concord, New Hampshire. His community is in the northeast region of the country. His community has a population of about 80,000 daytime and 43,000 overnight residents. In his role, Carlos is responsible for planning, engineering, building, and trade inspections, health and licensing, economic development, zoning and administration, and the municipal airport. In addition, Carlos is the Local Government Hispanic Network board member and former ICMA Northeast Regional Vice President. Next, we have Garrett Contreras, who is the fire chief of Hayward, California, in the West Coast region of the country. Hayward is a community of about 160,000. In his position as fire chief, which he has held since 2012, I believe, Garrett is responsible for about 118 firefighters, 9 fire stations, 9 fire companies, and 2 truck companies in his community. And he is known as a leader who helped to open the first in the nation firehouse clinic in Hayward. Next, moving to the Mountain Plains region of the country, we have Raymond Gonzalez, who is the county manager of Adams County, Colorado, with a population of about 515,000. He's responsible, obviously, as county manager for implementing the policies and priorities of the Board of Commissioners and overseeing the day-to-day operations of the county. Ray is also a local government Hispanic Network board member, and he's the current Mountain Plains ICMA regional vice president. In addition, Ray is the recipient in 2019 of the Colorado City County Manager of the Year. He was the first county manager in his state to receive this honor. And finally, from the southeast region of the country, we have Ramiro Inguanzo, who is the Deputy City Manager of Bal Harbour, Florida, which has a population of about 25,000, although it is part of the Metro Miami-Dade region, which is home to about 2.8 million people. Ramiro is also on the Local Government Hispanic Network Board, and he's the current president of the Miami-Dade City-County Management Association. And once again, I am Pat Martell, and I'm the ICMA West Coast Regional Director. At this point, before we actually move into our planned discussion, we're interested in learning from each of you in our second polling question about how long and how you are interested about the potential implications of the pandemic for your community. So we'll go to the second polling question and gather some data from you.
Right. Thanks, Pat. Firstly, let me, and I apologize, I should have asked this before. So we have a first poll. We want to know a little bit more about who's in the room with us today and what your, about your agency. So let me stop share, and I'm going to start a poll, and I'll give you an opportunity to ask or answer some of these questions. The first question is, how large is the community or population that you serve? And then secondly is in which ICMA region is your community located? And then third, about this topic that we're talking about today is, are you currently in a stay home or shelter in place community? So if you wouldn't mind taking that poll real quick. See, 7 of the 28 of you in the room today have submitted your answers to that. Let's give you another 15 or 20 seconds if I could, please. And, just another couple seconds. Anybody can wrap up your answers. All right, well, we have 17 of you that answered the question, and let me share those results to you, or hopefully you're able to see those on the screen. Looks like a majority of you are in cities that are, or communities that are over 1 million in population, with a mix below that, ranging from those less than 25,000 up to 1 million. Looks like many of you are in the Southwest. I noticed a lot of registrants from Arizona today, so we're glad to have you here. And we have a nice dispersion throughout the country. We need to work on getting the Northeast to participate. And what's amazing is that all of you unanimously indicated that you are currently in a stay home or shelter in place community. Very telling of the times that we're currently in. I have a second poll now that Pat alluded to that I want to share with you as well. And we'd like to find out from you about what the impacts are you feel in your community. So the first question is, how long do you believe those stay home orders will be in effect? And then secondly, how severe of an impact do you believe the COVID-19 pandemic is going to have on the community that you serve? Whether it be fiscal, operational, service delivery, we're going to give you a little bit of, a little bit of latitude in answering that. So if you wouldn't mind answering these questions as well. We've got 15 of you have answered it. Hopefully we'll get a few more of you to do it. We'll give you another 15 seconds or so. And we'll let's close down another 5 seconds. Another couple seconds for you to click that submit button. All right, I'm going to go ahead and shut down the polling now. And let's look at these results. Many of you think that we're probably stay at home through the end of May. A few of you actually even think that we're going to be going into this environment through the end of summer or even the end of fall. Apparently, nobody has a large enough toilet paper stash to by which to determine how long it's going to last. And secondly, it's really interesting to see this in terms of the dispersion here. About many of you think that it's a high impact it's going to have in your community. Several of you said severe. Some of you said moderate, so it'll be interesting to just kind of gain those perspectives as we address this today and through the question and answers. So with that, I will stop sharing the results and I'll turn it back over to Pat.
Thank you so much, Steve. Well, let's move right into a view of the discussion topics that we'll be covering today. We have 3 topics that we're going to spend some time in. The first is sustained engagement, and that's really going to relate to what we were inquiring about in the last poll, which is how long will this pandemic affect your communities, and how long will it affect the workforce that supports service delivery in your community? The second topic will be supporting the essential workforce. We'll have a little discussion about essential versus non-essential. Many people have taken offense at the idea that there is a difference between essential and non-essential personnel in our communities, because everything we do in local government is essential. So we'll be having a conversation about that. And then finally, we'll be talking about fostering health and well-being, because in order for us to be able to do the important work of local government and delivering services to our communities and fostering the well-being of the community, we ourselves have to be in a state of mind and in a state of health that helps to promote well-being. And we'll be talking about ideas about how we can engage in self-care, how we can make sure that we take care of ourselves as much as we're trying to take care of other people in our communities, in our city organization, in county organizations, as well as our families. So we're going to start the conversation and follow up on the poll that was just asked of you about how long you think that this pandemic is going to continue. And it's been said that, this pandemic is not going to be like a sprint. It's going to be more like a marathon. So we expect that it could go on for some considerable amount of time. So given that, I want to kick it off by starting with Carlos. And Carlos, what do you think is required of an organizational leader to sustain your team and your community for long-term recovery?
Thank you, Pat, and good afternoon on the East Coast. I'm the only person in the Northeast apparently watching this, so more power to us. So I think that's a very critical question, one that we've been dealing with for the last 3+ weeks right now. And I think that for me, one of the things that we had to deal with is figuring out, okay, we have an emergency situation first, and going from that mindset of how do we respond right now to what's happening in terms of, do we send employees home? What facilities do we close? How do we deal with our business community? And that's where your training for the people out there that might have some emergency background training, management training, that's very helpful, because that will help you avoid that panic that you might initially get. And hopefully you can relay that sense of calm to your employees because you have a plan. But once you get over that initial sort of adrenaline kick, then you have to figure out, okay, what do we do now? Because this obviously is a long-term situation, as the poll indicated. People are talking here in New Hampshire, we're thinking definitely June before anything really gets back to normal. and people are talking further out even. So one of the things that we've tried to prioritize is really communication with our employees, because so many people, we have nearly 500 employees, and they're all over the place. Most are working from home. That is a challenge because I know that just physically we need that interaction to really be healthy emotionally. So trying to foster ways to do that has been a challenge, but we've been doing daily calls, for example, with our division heads. We do a weekly summary with our departments so that all the employees in the city know exactly what's going on. And I can't emphasize that enough. The notion of, you have to be honest with folks. Folks are searching for facts because they don't feel like they're connected anymore. So we have been very candid with our staff, telling them, look, this is what's going on. This is what we know right now. But we're also vulnerable because we don't know all the information as well. So we're also conveying that also to our team. So, and ultimately, you also have to look at the big picture here. There's a reference, I think, sort of most of us, is what happened in 2008 and 2009 with the economic crash. And at the time, one of the things you have to do is take a step back and realize what is your role as a city leader and a city government for the bigger picture in the economy. And so what do you need to do? Does that mean you have to go all in terms of investing capital projects to keep your local economy going? So those are the broader questions that we're asking ourselves right now as well.
Okay, thank you for that, Carlos. So Ray, can you share with us, being in a really large organization, serving a very large population, how are you approaching, as the leader of your organization, sustaining your teams who may be, spread very, very broadly across the community, to help with long-term recovery?
Great, and good morning, everyone, and thank you for joining us today. And Pat, thank you for that excellent question. One of the things that we're doing as part of our emergency management and recovery strategy is I've identified 7 key areas where there is an opportunity to ensure that our resources and support are strengthened and effectively and efficiently aligned with the residents and businesses that we serve. The first one is childcare for critical personnel, business support, senior services, uninsured and healthcare access, housing stability, food security and basic essentials, and then support for the unemployed and future workforce. And one of the key strategies that most communities are dealing with is trying to identify a role for the elected official. And so I've asked our elected officials, our county commissioners, to champion each of these 7 key areas as part of our emergency response and recovery efforts. And it's been a huge success. We've also identified a convener, which we are they are the subject matter expert that really could help guide these conversations in our community. And I'd like to say that we've had a huge success in some of these areas. For example, as a result, our governor had an open enrollment period for Coloradoans to submit for health insurance. While that expired on April 3rd, we had identified over 50,000 residents who are uninsured in our community. We submitted a letter to the governor and asked him to extend that open enrollment period. He did that through April 30th. And so a key strategy for this response team is to make contact with those 50,000 residents to encourage them to apply and take advantage of that healthcare access. Another one is small business support. In Adams County, we have launched a Adams County stimulus program where we've established a $5 million small business loan relief fund for small businesses. And the purpose of this relief loan is to be a bridge loan that could help these small businesses carry them through 2 to 3 months of capital up to $50,000 until they close on their SBA loan. And we're hearing that first round of loans to close in June. And so the purpose of our business loan is really to serve in that short-term basis. So that's one example of how we are trying to ensure long-term recovery for our community.
Thank you for that, Ray. So let's move on to the next question. You know, it's been said that the job of a leader is to define reality and to give hope. So as organizational leaders, how can you ensure that you are inspiring your staff who are dealing with this COVID-19 pandemic to remain committed and engaged at a time when many of them, as the residents of our communities and our country and around the globe, are feeling uncertain about the future, they're feeling isolated and disconnected. So what are you doing to keep people engaged, to be inspired to continue to do the work, whether they're working remotely or whether they're frontline responders? Let's have Chief Contreras start on this question.
Sure. Thank you, Pat. Good morning, everybody from the Bay Area in California. I think it's an interesting question. I personally solicit to a definition of leadership that I steal from Marty Linsky, which is upsetting those around you at a rate that they can absorb. In a situation like this, I think waiting until you're making the right decision is a little bit late. And we're seeing that happen across the country. So empowering folks to be innovative and have buy-in into the decisions that are being made and having them well communicated across the city organization or the county organization is imperative. I think the reference to essential employees is a bit short-sighted. As we all know, most local government jobs wouldn't exist if they weren't essential. But there are those decisions that have to be made to protect employees and prevent exposure to a virus like COVID. So finding ways to engage staff at every level of the organization so that they can add value and exercise their own leadership and bring their ideas to the forefront is really imperative. A couple of the ways that we've done that in the city of Hayward is using what are termed non-essential employees, even though that's a bit of a misnomer, but reassigning them, not necessarily out in the field where they wouldn't be comfortable or they would be exposed to COVID. But for instance, in Hayward, we've established a call center that is a live hotline. Traditionally, information goes to the 211 system in the Bay Area, which is serving over 7 million residents in the greater Bay Area. And it's a heavily impacted system that is not very, it's not very detailed to specific jurisdictions. So establishing that hotline brought in a series of employees. We have 6 to 10 of them in the call center at any given time. And that keeps them both up to date on what's going on all the information, but it gives them a sense of value that they're part of the solution. And some of the ideas we've come from those folks have been remarkable. So those are some of the things that I think are important. As far as keeping the first responders and folks engaged, I think a lot falls on the city government or the local government to express repeatedly that the organization supports their efforts and is going to be there for them in the long term to ensure that they're willing to take the risks, calculated risks that are necessary to engage, whether it's a police officer in the street, or a firefighter, paramedic doing their job, or a wastewater treatment plant operator continuing to come to work because it is such an important thing, or the water department continuing to function at a high level. Tech services, constantly reminding folks what it takes for the quote essential employees to be able to do their job. Oftentimes, in our department, I point to our folks all the time to remind them, there's a red light that comes on in the fire station when a call comes in. And it's a constant reminder to folks, all of the people that it takes to make that red light go on, from the tree trimmers that are trimming the trees, to keep the connectivity, to the tech service workers that are working the technology, to payroll and HR. It takes the whole body of an organization to keep that red light going on. And I think that's repeatable in any organization across the land.
Thank you for that, Chief. So Ramiro, you're in a relatively smaller organization by comparison to some of the other panelists. And so I'm assuming have fewer staff. For smaller organizations who may have smaller staffs and are stretched very thinly to do the work of government on a normal basis, when you're in a situation like we are now, what are you doing to help lead the effort to keep your employees engaged for the long term, even though they've been sent home? I think we're not hearing you. Are you muted?
There we go. I'm so sorry. I was muted. Thank you
No
for the question. I can tell you this, being in a state where we 6 months out of the year prepare for hurricanes, we do a lot of planning and preparing for emergencies. And as part of our incident command structure, we, in an emergency, typically move into Alpha Bravo type situations and incident command type situations where all employees really are essential. You may not do the job that you typically do under a situation that's not an emergency, but there's a lot of work to be done, and there's a lot of reassignments of individuals to do different kinds of things, as the chief alluded to when he was speaking a short while ago. I can tell you what we've done. 3 weeks ago, we moved into our Alpha Bravo scenario for a couple of reasons. A, to create more social distancing in our city hall so that there weren't as many people there at the same time. So our entire staff was given a responsibility of a series of things that they were accountable for and responsible for in ways that they could help. So there's an A team and a B team, and we transition every 9 days. It's a full work week plus the 2 weekends. So every 9 days we're transitioning between our A team and our B team. It doesn't mean that if you're not physically at the location, you're not engaged. Our staff and our various representatives for each of our teams connects daily, twice a day. We have a 10 a.m. call and a 4 p.m. call. All staff is engaged, whether you're at City Hall or working remotely from home. So everybody is tuned into what is going on. And it helps tremendously. For example, this is the week where I'm working remotely. I'm from home. My counterpart, the manager, is at City Hall. So it provides the ability for those that are not working at City Hall to get some rest, to be with your families. A lot of our families are home, kids and spouses who are working remotely from home or just home. So it kind of gives the ability for employees to get a little bit of rest, stay engaged and connected, and yet know that you'll be coming back and kind of being at the front lines, doing what you're supposed to be doing to helping our residents and our businesses and so forth. So in our city, that's worked very well. Our whole staff is working and engaged. It helps that some are at the front line for a 9-day period, and the other part of our staff is at home working remotely. And then we know we kind of switch back and forth, and it's created a good environment for our team.
So you alluded in your comments, Ramiro, to your being used to hurricanes. So for the rest of the panel, I want you to think about what are the crises that you have faced in your careers? And I'm sure there have been others, whether they're natural disasters like hurricanes in Florida or wildfires and landslides in California. I'm sure all of you were involved in one way or another during the Great Recession of 2008 and 2009, which affected organizations across the country in terms of downsizing and creating a new normal for local government. So drawing on some of those prior crises that you have faced in your careers, what are some of the lessons learned in those difficult circumstances or best practices that evolved from those crises, which are helping to inform your response to this pandemic? Is it similar? Is it different? What can you tell us about what you've learned in the past and how it's informing what you're doing today? And let's put that question back to Ray.
Thank you. One of the lessons learned for us, it was the floods in 2013. A couple of things from an internal perspective. We learned, FEMA requirements. We established different cost centers related to this, to COVID-19. We actually have a different tracking mechanism for time and reporting requirements because we went through this back in 2013 and had to create all of this. And so those are some of the lessons learned from an internal perspective. But the big one for me is communication and coordination, not just with our residents, but our employees and all of our stakeholders. In Colorado and in Adams County, I'm very proud that we have a strong relationship with all of our municipal partners. We have 10 cities that reside in Adams County. I meet with them on a weekly basis. I host a ADCOG, which stands for Adams County Council of Governments, regional coordination call, Zoom call, and you know, public health is a core function of county government, and so the health department is part of the county, and so we provide our cities with access to our public health director that can answer specific questions. We also do telephone town halls as a way to communicate to our residents and to our employees. I know these are easy things. We have 2,500 employees in Adams County, and communication is key. One of the things, I'm not making a plug for Facebook, but what we have implemented 2 years ago is Workplace by Facebook, which allows me to interact with all of the employees. I could do instant videos and send that out to all 2,500 employees. And so that has been a very effective tool communicating through this crisis. I host a telephone town hall for all employees every other week that allows me to call them directly and communicate. So those are some of the things that we're doing.
Now, Carlos, do you have any best practices that have been developed through other crises that you've faced in your career that is helping to inform what you are doing with your organization today?
Sure. So I think what we've learned here, and I got to applaud Ray for what he's done in Adams County. That's incredible, some of the work that they're doing there. So we're obviously on a different scale here. And one of the things that we've learned going back to a point from a little while ago is the sense of you don't want to lose perspective in the long term, because we're all reacting in the short term largely just because of the nature of the crisis. So I used to work not too far from where Toledo is. I used to work in South Florida, went through 4 hurricanes. And, you know, you're activated and that's 24/7 and you've got that feeling of like, well, I just got to get through this. But the important part that we found is making sure you can get back to the routine. The routine, everybody's daily routine is very important to ground your employees, and which in turn will ground the organization. So we've made an effort to maintain that routine right now as much as we possibly can. And that includes everything from basic, you know, let's have the same meeting times that we've always had, despite the fact we're doing it virtually. Let's continue the budget process, again, despite the fact that we know it's going to be impacted, but we're in the middle of our budget season. And even our capital programming, which in a community of our size, so we're the largest driver economically from a government perspective, probably us in the state, in this region, and this is the capital city, so we're a big player in that sense. So during the recession, we made a point of we were not going to gut our capital program, despite the fact that that was what the short-term thinking would be. It's like, you know, stop spending millions of dollars on infrastructure. We can't afford it. Our perspective is no, we have to keep the eye on the prize. But then the prize is not, it's not the end of June of this year right now. The prize is a year from now, for example, 2 years from now. And so those are the kind of conversations we're having with staff, and staff is very much open. And I think they appreciate, even the frontline staff, the notion of, you know, we are not just automatically forsaking everything and throwing everything out because there's a fire, because we know how to put out this fire, and we know it's going to be put out, and eventually we'll rebuild the house. And so that's the approach that we're taking.
Okay. Well, let's move on to the next discussion topic about supporting the essential workforce. Local government organizations and their respective workforces are struggling with this concept of essential versus non-essential workers, where we differentiate between the frontline workers who are remaining on shift work and those who have been sent home to work remotely. So I'd like to have you all speak to how your organization has defined employees for purposes of maintaining critical services in the community. And why don't we start with Garrett? Chief?
Sure. So I think there's a few different phases of this. There's obviously the, during this effort of suppression and isolation, quarantining, there is dealing with all of the concerns that in the immediate aftermath of a shutdown like this, whether it's law enforcement or fire agencies, first responders in general, the immediate fears of being exposed and bringing it home to your family. So finding solutions that can start to bring some answers to that process and bring some clarity to that, how concerned folks should be, and then acting out and showing that the city organization or the county organization are going to be there first and foremost with things like personal protective equipment and making sure that those things are there. And to Carlos's point, looking at the end game, the long-term plan here of how do we start to normalize for not just our workforce, but for the community at whole. And providing those kind of insights into the rank and file employees so that they understand the why of why we're going about what we're doing. It starts, like I said, with the PPE. We had an experience very early on, and that's a few weeks ago in the Hayward Fire Department, where we had a number of folks that had been exposed and been on quarantine, and we could not get them COVID testing. We could only get a flu test. One of those individuals' wife is an emergency room doctor. She was not being allowed to go back to work until he had a negative COVID test. So with that effort, we needed that peace of mind for our police and fire, that we were going to have the ability to test them. There was no testing available, so we contracted with a lab and started testing police and fire and healthcare workers in our communities to start that road towards an answer to the why. Why are we doing these things? And what is the organization doing to ensure everyone's safety, not just their personal safety, but that of the public and their families at home. And then as you start to look at that longer term approach, what is the plan? Why are we going to continue to do testing? Well, we want to normalize the workplace for all of our city employees sooner rather than later. The Alpha Bravo concept is widely used in disaster preparedness. And right now, we're not even at a point to where we can have a full Alpha Bravo in-house. So we're very much a skeleton crew for the foreseeable future. But what is the plan? What are the steps that we can take to start to bring back the workforce in masses so that, as was mentioned, we can focus on budget, we can execute on the things that were already planned and show the community that we can land on our feet, we can walk and chew gum at the same time. And this is not the first disaster that we will have dealt with. And I think that sends a sense of calm and purpose to everyone that there is a broader plan. Very few organizations could have been fully prepared for an event like this. And I think there is some wiggle room there for being fluid and changing on the fly. But also taking risks and being courageous as leaders within our government. That is the expectation from the public that we serve, is that we take those calculated risks. We're willing to be courageous and make decisions that are in the best interest of the community and the employees that serve the community. So that would be my answer to that.
So for the rest of the panel, have you heard among your employees, both those who are on the job, who are first responders, and those who are working remotely, a sense of feeling as though they're being treated differently when they really want to contribute to actively supporting what needs to be done in your communities, and feeling like their hands are tied because they've been sent home and they're not able to do that? Or on the other hand, those who are first responders and essential workers, feeling like there is not a concern for their families, and they're being able to take care of them because they're having to be out on the front line, 24/7, assisting with the broader community response. Let's toss that question to Ray.
Great. So first of all, we were one of the first counties to, we were the first county to close in the state of Colorado to the public. And so, the chief mentioned about, as leaders, it's important to be courageous. And I can't stress that enough. Being courageous and authentic are key in everything you do when you're trying to manage a crisis. So the health and safety of our employees and the residents is my number one priority. And so when you talk about the definition of essential services, I agree with Pat. Everything we do is essential, because whether we are providing a direct service to, or processing a food assistance application, that is essential because they need that resource in order to care for their families. But one of the things that I did was reassure our employees that their jobs and benefits are safe, no matter what, through this effort. We're in a very different financial situation. We are financially sound, and so I am able to say that. There are communities in Colorado that are having to furlough some of their employees just due to this public health crisis. But one of the things that I've done that's different is for our frontline staff who don't have the ability to work remotely, is we introduced an incentive pay for those frontline staff. And whether we call it a hazardous pay or incentive, they have been receiving that. In addition, one of the things that I have 80% of our employees working remotely. Since we were the first county to close, most of our stations are desktop stations. And so I approved renting 600 laptops, and we checked out 600 laptops to our employees so that they can set up workstations at home so that we can continue serving our residents. And so today I'm proud to say that 80% of our workforce out of that 2,500 are home providing services remotely. We also pushed Access Adam online. Most of our services can be done via online. And so there's a huge campaign out there pushing our residents to use that.
Great, thank you. What about you, Ramiro? What are you finding how you are distinguishing between what's essential and non-essential, and how are you supporting staff who feel like they are not part of really making a contribution to the ongoing pandemic response?
And let me, and I'm gonna, with the Miami-Dade City County Management Association, which is made up of the city managers, we've got 34 cities. We connect at least once a week, so we talk about this a lot. I think for most of the cities we have, because again, we are used to kind of moving into those emergency situations because of the active hurricane season that we experienced for half the year. So I can tell you from my city's position, the Alpha Bravo structure has worked very well for us. Even the team that is on at the front lines at City Hall and our law enforcement, when they're there, one of the things we've done is we set up lunch for all staff. Box lunches. We partner with several of the local restaurants in our community who prepare the box lunches. We've created seating that's social distancing appropriate out in one of our parks that's closed. The weather, thank God, it's still early April, so it's really beautiful here, so we can be outdoors and enjoy the outdoors. So we have a lunch time from 12 to 2 o'clock where employees can kind of come and go, grab their box lunch, sit if they like. There's areas where they can sit. It's provided an opportunity for our law enforcement to engage with our employees that are not law enforcement. Again, a lot of employees who are working and are there are doing jobs that aren't typically the job that they otherwise would do. They may be assisting law enforcement in one way. They're answering calls at our call centers. They're assisting with dispatch. We've multi-trained employees to help in the critical areas where we really need them now. But that lunchtime opportunity for our employees has been really valuable. People like coming out to our park, seeing people from other areas and having an opportunity to kind of just engage and connect and see each other. And that's worked really well for us. Our employees are very appreciative because they don't have to worry about either ordering lunch or preparing it at home and bringing it. They know that every day they'll get a really nice meal that's been prepared by one of our local restaurants. And it creates that opportunity to get people away from their computers and even law enforcement off the streets and come in and engage with people and just talk from a 6 to 8 foot distance, but nonetheless have that human interaction that I think so many of us are lacking right now because we're doing these kinds of things. And let me just add to a point, Ray mentioned it and the others have mentioned it as well. Thank God for technology. It is amazing that we get to do this. I've spent, it's almost 2 o'clock here on the East Coast, and I've been since 9 o'clock in Zoom meeting after Zoom meeting because I'm working remotely from home this week. But I've been able to connect with our county mayor. He holds a meeting 3 times a week with the Miami-Dade County League of Cities, which is made up of our elected officials, and with myself representing the Managers Association. He meets with us for 1 hour, 3 times a week to tell us what he's doing from the county level. I've met with my team at our city hall. I had another Zoom meeting. So thank God for technology that allows us to stay connected. Even though it's virtually and it's not ideal, at least we're able to do our work. And like Ray, like you said, I think you said 80% of your workforce is working remotely. That's great. They're doing their work. They just happen to be sitting someplace other than your county hall or city hall, but the business of the people can continue, and technology has allowed for that in many ways. So it's a very positive thing.
So a final question on this topic I want to pose to the panel is, have your organizations taken any specific actions to help support and inspire those who are working remotely to be innovative, even though they may be working under totally different circumstances, they're not fulfilling all of their normal job requirements? Have you done anything to really encourage innovation, sharing of ideas, and risk-taking so that people feel that they can contribute to the pandemic response in a different way, creating for themselves the opportunity to be leaders, where we think in terms of leaders being people who influence, not necessarily because of a title or a position, but the ability to influence. So have any of you taken any specific actions to encourage that? Carlos, what about your organization?
Sure. So here in the Northeast, one of the things that we suffer from, unfortunately, is that we've got very, very, very old restrictive rules that go back to colonial times, it seems. And so what we found with this crisis is that those rules, which we had just accepted because that's just the way we do business here, really don't work when you're trying to do virtual meetings, when you're trying to get things done in this pandemic environment. So what we found is that we gave our staff agency to say, figure out what we need to get done, what rules need to be changed. I'm talking about state statutes here. And then let's advocate with the governor's office to have those things changed. So we worked with the Managers Association here in the state. The State House happens to be literally across the street from my office. So we could reach the governor's office directly and say, these are the things that we've identified that we need to change based upon our experience here in Concord, which is not unique to the rest of the state. And for largely New England's this sort of model of government. So encouraging staff to do that. And the things that we've learned is that the governor has reacted and changed, issued several executive orders to allow for these changes. They're temporary, but what we're hoping is that everybody sees the light of day finally and realizes these are kind of things that we want to have in place on a permanent basis, because it makes government much more accessible in a way to people than it has been in the past, because we've been bound by these very archaic regulations. So that's one thing that we've encouraged folks to do. As part of that, one of the things that's been striking me a lot is the term is we've been listening a lot more. And I find that when you're in a face-to-face meeting, sometimes you react to body language and you start to speak up before you really have contemplated everything the person's saying to you. And when we have these type of meetings, I think we're much more prone to just let's listen, let the person finish their thought. And that's really helped our staff as well, and helped me personally just kind of hear the ideas that people are talking about, and then provide that leadership support to make those ideas happen. And I've also told our team that The reality is that whatever decisions we make right now, somebody 30 days from now, 60 days from now, 6 months from now will think that was a really stupid decision. And that's okay. We just have to accept that because we're making critical calls based on limited information that we have at any given point. And I think Garrett mentioned this as well. It's just one of those things that as leaders, you just got to make the call. And so we encourage our staff to make the call because we're not all together. We can't necessarily convene a meeting very quickly to make that decision. So we're saying, well, go ahead and do what you need to do because we trust your judgment because you've been part of our organizational culture for X amount of time. So you imbued with what's important to us and what's important to our community. So those are the kind of things that we're doing here in Concord.
So
Pat, if I can add.
Oh,
I'm sorry, Pat, let me just add real quickly because, I've heard from a lot of employees who work in government how appreciative and grateful they are that they have their jobs and that many of us haven't been furloughed or laid off. Our colleagues in the private sector perhaps aren't as fortunate in that regard. And maybe that's because, the work that local governments do really is so essential. But I can tell you, I've seen not only in my city, but in several cities across our county, and I've heard from a lot of city managers from across the county, what initiative they've taken. We've had employees who have volunteered to coordinate the making of masks, the cloth masks. The CDC is recommending that individuals in the public wear cloth masks, not the surgical or the N95 ones that medical professional needs, but just cloth masks. So you see employees coming together and coordinating efforts to make those kind of masks. I've seen a drive here locally of employees who are creating well wishes for the seniors or people who are stuck in ALFs or other type of facilities that can't get out. And there's guidelines you have to follow about whether it's paper or video, but they're creating positive messages for the community. I've seen people come together and create schedules of virtual classes and different museum offerings and boredom buster type things to just kind of get out to the community. So there's a real sense of people, I think, the employees in government who want to help in some way. And if they really, really don't have a role, I've been very encouraged to see people be innovative and come up with suggestions. And I know in our organization, anytime somebody comes up with a suggestion, we say, go with it and help coordinate it and, put it to action and we'll support it. So it's encouraging to see people wanting to help in even small ways. And, I think, again, we're very blessed that in at least our industry, we haven't seen a lot of furloughs or a lot of people being laid off. And I think, we've got a workforce that is eager to help in any way possible, even in the very small ways.
great. Well, we're going to have to move on now to our next topic, final topic, which is fostering health and well-being. We're running short on time, so, but I do want to pose a couple of questions to the panel before we open it up for questions from the participants in the webinar. The first is that social distancing is contributing to a lot of anxiety and uncertainty and people feeling isolated. What steps can your organizations take to reassure workers at every level that continuing to network with their colleagues, even remotely, is a really positive response to the current circumstances, even though they can't be at City Hall and even though they can't be contributing on a daily basis to the work being done by our first responders? Ray, do you want to start with that question?
Sure. One of the things that I really try to encourage is, and I think it was said earlier, I do meet on every day with my senior leadership team, and we're a large organization, and so communication is key. And so I encourage our department heads to have staff meetings, whether it's through Zoom, and as well as even Zoom happy hours. I think it's okay for them to socialize with their colleagues, whether it's their peers or so forth. But one of the things that I really love watching is on Workplace, our employees have created different scavenger hunts on Workplace by Facebook where they're posting certain things that they like, and it's just encouraging this interaction on a whole nother level that just brings a smile to my heart, because I think at the end of the day we would all rather be at our county hall, and it's just it makes it a big difference when people interact. And so those are some of the things that we're doing to promote social networking with our colleagues, whether it's through Zoom or even Facebook, our Workplace by Facebook.
So let me ask you, Chief Contreras, in Hayward, are you soliciting feedback from employees about how your organization can be more supportive to them during these stressful and uncertain times?
We are, and generally, you know, there's obviously the one-on-one conversations and the small group conversations that take place departmentally and oftentimes can be siloed. One of the more effective ways of communicating and reassuring is through the bargaining groups and the respective employee groups throughout the city. Where you can give clear and concise information that you can trust is then going to hopefully be disseminated accurately to the bargaining groups. But starting there allows for facts to be put out before things, you know, rumor mills or anything else are kind of come to the forefront. So I think that's one of the areas. Another way of really we found it being very effective is you know, really digging deep to recognize the really small things that happen, the innovative decision or the thoughtful approach, the small response at 10 o'clock at night from a staff person to a member of the public that was concerned about a water bill or a rent stabilization issue, and senior staff, executive level staff, reaching out to that individual to say, hey, great job. That's the type of exercising of leadership that we need to see at every level of the organization, has a really profound effect on reminding folks how important they are, and at every level of the organization, from the entry level clerk to the city manager. We all have a role in serving our public and being responsive in a timely manner. And those are things that I see firsthand having a lot of value for staff that is in that strange place right now. Am I valued? Am I important? Am I essential? I think the other way that really can be done through leadership at the top of the organization, and I think police and fire in particular, because oftentimes we are the visual face of praise, if you will, or opportunities for the community to say thank you. But making sure that is rightfully placed on the employees that are adding such value, and deferring that praise to the staff that really made that happen, or the free pizzas or lunches that are coming to a fire station because people don't know where else to take it, saying thank you and being gracious, but then encouraging that to go to a homeless shelter or to another place, because we have to remind everyone that we are, yes, we're challenged in these times. It's local government, but we also have some assurance of having a paycheck, and we really need to show our community and the rest of our staff that every single person is important in a tough time like this.
Thank you for that, Chief. And with that, I'm going to ask Steve to open it up for the last couple of minutes that we have, to see if there are any questions from those who are attending the webinar today.
Sure, thanks, Pat. And again, if any of you have a question, please use the raise hand feature within the Zoom application. And just once again, so that you can see that, let me come back here for a minute, is that you would go down to likely the bottom or the top of your screen, click raise hand, and that will allow us that you have a question. So not seeing anybody raising their hand quite yet. But I'll let you know as people do. So.
Okay, well, if you have a question, please raise your hand. The panelists are glad to respond. But for the last few minutes then I will continue on with this issue related to fostering health and well-being. So are any of your organizations actively establishing new HR policies and implementing any kind of changes with respect to guidelines for employees to address their health and well-being during this pandemic? Let's go to Ramiro. unmute.
Yes, there you go. We haven't as of yet, Pat. I'll tell you, a couple of things, I guess, to address that issue is in our city, we actually have a very, very liberal. You can take up to 90 days per medically documented. So fortunately for us, we've not had any employees that I'm aware of that have tested positive that have requested leave. But in the event that they do, we've got that liberal leave in addition to the federal guidelines that have come out with the Family First Act as far as the type of leave that's to be approved for employees. We're a small organization, so I think if there's an issue that develops, we'll kind of deal with that one-on-one perhaps if we have to. There may be at the end of this, there may be policies that we revisit, and trying to figure out what the right thing to do is. I know weeks ago, something that a lot of cities struggled with was, a policy regarding working remotely from home.
Mm-hmm.
A lot of cities had that in place, but I think we all kind of figured it out. And I think if you could have employees work remotely, that we've made the accommodations to do that, if it's possible. But other than that, we luckily at this point haven't had to deal with anything as of yet.
Thank you. Chief Contreras, being first responders, are there any things that have been developing in Hayward's organization to deal with first responders and issues that arise that, in the past you really didn't think about the safety of your first responders in the same way that you are today?
Yeah, I think the first thing that comes to mind is the 2-week leave for isolation purposes for our positively infected personnel, both in public safety, but also outward facing public employee staff. I think our HR department has been very receptive and understanding to the need to give that reassurance so people have the confidence to come to work, and that if they do have an exposure or they do contract the virus, that they're not going to be left to use sick leave for that purpose. I think that has been incredibly reassuring. Our police department has also gone through and created a new shift schedule where they're working 12-hour shifts. That basically, it's similar to an Alpha Bravo concept, with the concept being if half of the department is exposed on a day, you still have the other half of the department to continue to work. In the fire department, we've taken a slightly different approach where we are testing our personnel at the end of their tour of duty. They get tested, and then they get tested before they come back. And anyone who's positive is placed in a 2-week quarantine or 7 days from the time that their symptoms are diminish. Those are the current things that have taken place. We are having a number of conversations about more long-term approaches as it relates to those HR functions and working through with the bargaining units. Again, it's incredibly important. Even if we have difference of opinion with the bargaining unit, it's very important to start there so that there is a level of trust and respect that the conversation is coming from an employee-centric place and not a top-down kind of mandate that there's collaboration along the way.
Mm-hmm.
As I mentioned early on, we started a testing site that initially was intended for public safety and healthcare workers, but we immediately realized that the public was not being tested. So we expanded it and we have public testing. Well, that required, my first conversation was with the president of the firefighters union to say, hey, we're going to use our paramedics to do this testing in the public and our long-term nursing facilities and our police officers and other city staff. And we had to come to agreement that that was the right way to go. Had I not started with that conversation, we probably would not be using our paramedics to swab patients, and we wouldn't have that expanded scope. So of course, there's always going to be two different opinions, but starting in that place, regardless of of in my opinion, what state you're in, whether it's a right to work state or not. Our people are our most valued asset, and we have to start with that dignified conversation to say, this is where we're going. These are the facts. This is the changing dynamic that we are all faced with. Let's do this together and be stronger as a community. And I've found that really has a resonating impact with the employees as just a massive rank and file. When they are faced with a new change in their day-to-day work life, and the first call they make is to their union rep or their shop steward, and that response is, yeah, we're fully on board with that. This is what we've got to do. That has a really profound effect on the ability to be innovative, nimble, be courageous, take some risks, take small calculated risks, and it creates that buy-in across the organization that they're all part of the bigger incident.
Thank you for that, Chief. We did have one question that I want to see if we can respond to before we have to close. And the question was, how are agencies coping with the potential negative fiscal impacts from this pandemic? Anyone want to take a crack at that question and share what's going on? Carlos.
So we've had the approach of we're going to err on the side of being generous, which is what I think most of the panelists have said the same thing to one extent or another. So we've had people on and we realize that they're working to different degrees. And so we haven't had the conversation yet about furloughs. Yet we're starting to have those discussions about, because in a couple of weeks, if this goes on, we anticipate that there will be some budgetary impact. So we're still going to be generous with folks and provide them with negative leave balances to help transition if we had to do that. In the process I mentioned earlier, we're doing our budget prep right now for fiscal 21. We're a July 1 fiscal year community. So we've had everybody look at our expenses. We have put a hold on any discretionary expense right now. We've also put in a hiring freeze. So any new applications right now, we're not bringing people on unless it's absolutely necessary. We are making an exception for public safety because we've had long-standing needs, and particularly in the police department that really need to be filled. So we're looking at that. We are looking long-term also in terms of our capital program. And obviously, like I said earlier, we want to make sure we invest as much as we can, but we have to see if there's, for example, state-funded matching programs, that will the state be there to provide their dollars to our program? And what will that mean for us? Because as you know, cities usually are first in terms of the expenses, and then we get reimbursed. So we're having those conversations. But we haven't made any dramatic changes except, like I said, the hiring policy and the spending freeze.
Thank you for that. Anyone else on that particular question? If not, I'm going to move to our resource page. I want to share with the participants in the webinar today a series of resources that are available for your use. The first is the International City County Management Association, ICMA, has established a coronavirus webpage. It is open to both ICMA members and non-members. We want this critical information to be available to everyone serving communities across the country. So even if you are not an ICMA member, you will have access to a variety of information, some podcasts that have been done on really important topics. So feel free to go to icma.org and check out the coronavirus webpage. Both the National Association of Counties and the National League of Cities have established websites providing resources on COVID-19 on a variety of topics, and they are available for you to view online as well. Please make use of these resources. I know that many states, associations are providing information on a daily basis to cities and counties within the state, but these national organizations and international organizations also have a good library of resources that are being made available to you. So we offer that to you in the hope that that will help to address some of the issues that you are facing in your cities and counties across the country. I think we may have one more question. How are, let's see, oh, no other hands have been raised, I'm sorry. Oh, yeah, there is. I'm sorry. How are agencies preparing for the comeback of the hospitality industry? So, are any of you have you seen the dramatic drop off in hospitality activities, conventions in some cities, hotels being closed, and that kind of thing? And what are you anticipating for the return of those services in that industry?
I'll take a stab at that. Being in South Florida, tourism obviously is one of our major economic drivers. So it's been a very tough hit in that sector for us. March typically is the strongest month in South Florida. Our hotels typically do generate the greatest number of revenue in 2 months, December and March. Here in South Florida, we've been having, record tourism years. Last year in our city, we actually collect a resort tax, hotels, restaurants. Had a record year last year. 11 of the months last year were record months for us. This year, the first 5 months of the year, October, we start, October 1st is our fiscal year. October, November, December, January, and February were record months, beating last year. So we were on a trend of just, record growth. And of course, March is, just completely, our hotels are closed. There was a county order issued that closed all our hotels in Miami-Dade County. So no reservations are taken until the foreseeable future, until the order is lifted. So it's been a huge impact. Our tourism bureau, the Greater Miami Convention and Visitors Bureau, is working on a strategy. Dr. Fauci today on CBS this morning was somewhat optimistic when he was asked the question if he thought that people would be able to travel for summer vacations, and he was somewhat optimistic. He said that if, I'm going to paraphrase him, but if everybody continues doing what we've been doing, he's optimistic that at some point in the summer, people can kind of start going back to some kind of normalcy and start traveling. So that's really what we're preparing for at this point. We know that March, April, May, even June, basically are wiped out. So we're making contingency plans to really kind of July 1, start putting pieces in place to prepare for what tourism will look like, at least in our area, for the foreseeable future. But it's been an incredible hit for our county and certainly our state, which relies so heavily on those tourism dollars that come in.
Thank you for that, Ramiro. Anyone else care to respond to that question?
I would just add on top of that, we're not a tourist destination in Hayward necessarily, but the Bay Area is. And one of the things that is grossly inept right now across the country is the amount of testing. The reference to Dr. Fauci is noted, and I think many of the experts, and if you look at the data coming out of South Korea as well as Wuhan, Singapore, Hong Kong, Taiwan, testing is really the way we normalize. One thing that I've realized very quickly a few weeks ago was that we're not set up for that as a nation. And municipal governments, local governments, county governments, capitalizing the private sector labs to get up and running so that this country can be doing 3 to 5 million tests a week is really where we need to get to. And we're not going to get there using the traditional healthcare means. And LabCorp and Quest being the two main labs in the country, we've got to capitalize the private sector and challenge them to be innovative. And the PCR tests are the solution. It's the gold standard. The antibody tests are going to be helpful over the long term. But at the end of the day, we need PCR tests that are run repeatedly. And it's not about the first negative test for folks. It's about the third, fourth, fifth negative test where we can really start to normalize and know that we're not making the situation worse as we start to get businesses going. And that's our focus for our testing here in Hayward. Is as early as next week, we'll be transitioning into testing specific businesses to get them so that they can start to normalize more and more and know that they're not making the situation worse, and we're not going to encourage another spike down the road. So that's, thank you for the opportunity to opine on that for just a second.
Oh, thank you, Chief. I think we may have one more question. But I want to thank you all for your input today. I think it's been very valuable. I know that there's a lot to talk about. We could talk for another hour on all of these subjects because we're learning things daily, and life as we know it has changed. And we keep hearing that in the media that our lives in our communities and our country will be forever changed by this pandemic. But it's important for those in local government and government in general to recognize that our task is to learn from these experiences, to develop best practices, to be as innovative as we can in addressing the issues that we're confronting in our communities, and to help use that body of information for the future, because we'll face crises again once we get through this pandemic. So thank you all very much for your time, your input. I hope that it has been a useful conversation for those who have been on the webinar as attendees today. And we look forward through the Local Government Hispanic Network and management partners who is a strategic partner in helping to support the technology to provide this webinar, and all of the organizations who have been involved in this conversation. We thank you for your attendance today, and we wish you the very best in all of your organizations, and that we will all communities will come out stronger and better as a result of the work we're doing today. Thank you very much. Steve, I didn't know if we had enough time to do the last question, so I thought we should just cut it off.
No problem. No problem.
Great
Just
job, Pat.
a question, Steve.
I'll send an invite to you all so that we can maybe debrief real quick. So look for an email from me real quick. All right.
Okay.
Bye.
You do it now, Steve?
Yeah, I'll do it right now. Yeah.
Yeah.
Bye.